Hey everyone, welcome to HEADCHECK Health Talks. Today we have Matt Campbell, the owner of Midwest Concussion Clinic, on with us today. How are you doing, Matt?
I'm great. Thanks for having me.
Yeah, so why don't we just start off with you giving us an introduction about yourself and your work, and then from there we'll jump into the questions.
Yeah, perfect. So, like you said, my name is Matt Campbell. I'm the owner of the virtual Midwest Concussion Clinic. I'm an athletic trainer by trade, brain injury specialist, and brain obsessed by choice. I started a concussion clinic back in 2019. Got the partner, a great physician, back in 2019. Got up and running September 9th. Just like anybody else, we were hot and heavy, hit the ground running, and then COVID shut the world down, and we got a chance to step back and try to figure out what was working and what wasn't. Worked together, for the next 5 years, and then in January 2025, he got into a partnership with a larger hospital system. That the larger hospital system decided to move in a different direction and didn't want the concussion clinic. So, January 2025 transitioned into that virtual concussion clinic space.
Awesome. So virtual concussion clinic is the direction that you ended up deciding to go.
Mm-hmm.
Um, could you just walk us through, how do you do a full concussion evaluation remotely?
Yeah. So it's pretty easy if you think about, the nature of athletic trainers. We're all basically taught throughout school to adapt and overcome, right?
Mhm.
So you take every skill that you have, whether it's trying to put together a rehab plan or trying to put together a assistive device to help kind of take strain off of a joint, you learn to adapt and evolve.
Mhm.
So through a concussion evaluation, I have different tools that I have in place, different protocols, different testing that I can use through different companies. I also do a VOMS assessment on every patient that I see. And then I basically will look at doing balance testing, dynamic movements, just like you would normally do on a sideline or in the athletic training room. You do them virtually through the comfort of their own home.
Interesting. So, what about particularly things like vision and vestibular through a screen? Like, can you walk us through the unique challenges and kind of how you overcome those?
Yeah, for sure. The old school treatment approach with concussions is used to just put everybody in a dark room and say, don't use phones, don't
Right.
use computers, just sit here and heal. Well, the research has proven that outside of the first 48 hours, that actually will slow down your recovery time.
Hmm.
So if we start looking at it, we're trying to find a fine line between doing too much and not enough. One of the challenges that happens is I'm a virtual concussion clinic, so we have to find ways to utilize the screen times. So just like you can do anything else, I have created different videos and different things through Canva to help with object tracking, to assess eye movement patterns. The vestibular side of things is pretty easy to replicate. If I have somebody who's really screen intolerant, they really don't like it, have
Yeah.
them stare at their thumb, stare at a spot on the wall, stare at an outlet or a light switch cover, and get them to do the same type of exercises.
Interesting. So you mentioned outside of the first 48 hours. So does that mean that most of the time you are recommending darkness for the first 48 hours, or was that just more?
So the idea of the first 48 hours can set you up for concussion recovery in general, right? So
Right.
we're looking at the first 48 hours. We want as much mental, physical, strict rest as we can.
Okay.
Limit your phone time, your screen times, take it easy. One of my jokes with patients is I work in the medical world. I live in the real world. Everybody that you talk to is like, hey, we want you to limit your phone and your screen time. As soon as I leave the room or as soon as I look away from the camera, they're going to be on their phone.
Mhm.
That's not realistic. So, I tell patients all the time that I know you're going to do things that may not necessarily line up with what we want. So I'm going to teach you how to do them, how to use screen shaders, how to use different things with adjusting settings on your phone or your computer to make it easier for you.
Interesting. So yeah, you mentioned a multi-system approach on your website and stuff like that.
Mhm.
So can you walk me through what the different systems are that you're employing, especially in that
Yeah.
first 48 to 72 hours?
So early on, the initial assessment looks at vision, vestibular, cognitive function, static balance, dynamic balance. We're doing everything from reviewing certain vitamins and supplements, looking at implementing dietary changes and restrictions to help with the inflammation that's occurring.
Mhm.
The multi-system approach. One of my biggest challenges when it comes to the rehab aspect of concussions is you've got so many specialties that can get involved, and it's great to have a team that's involved, but if they're not treating the system as a system, if you're
Yeah.
treating just the eyes, if you're treating just the vestibular system, you can't treat them independently. So if I have a PT that's working on vestibular therapy and then right afterwards they go to occupational therapy, great, except for the fact that you've now overloaded somebody's system and you're treating each individual pieces and not the computer that controls the whole thing. So you have to, you can't put things in a vacuum. And in a perfect world, yeah, I can just do eye movement exercises and that wouldn't affect anything else, but that's not the way the body works. So unless you have all pieces working together, it's not going to work at the same time.
So we haven't ever talked about this topic on the podcast yet. So I'm curious to hone in a little bit on the supplementation part. What are some general supplements that are helpful in concussion recovery? Just as a left field question here.
For sure. So, brain injuries, concussions in general create a neurometabolic cascade, right? So not only are you looking at changes to the electrical signal disruption, you're also looking at changes to the energy production. You're looking at changes to the hormones. So when we start looking at vitamin supplementation, following a concussion, the brain is very deficient in vitamins A, B12, C, D, omega-3s, magnesium, and creatine. Well, if we're not getting those on a regular diet, especially if I have a 13-year-old athlete who's living on McDonald's chicken nuggets and cheeseburger, right? They're not getting that same vitamin supplementation that's happening. So now on top of having the injury that's occurred, we've already got somebody in a vitamin deficit. So at the very bare minimum, I try to get every patient that I work with to take a multivitamin, take some omega-3s and creatine to start their recovery process.
It's interesting because I've thought of this often, and the only one I ever really was sure about was omega-3s. That just seems pretty simple to me. It's like the building blocks of the brain. But I never thought about creatine or multivitamins. So that's interesting.
Yeah. So there's a lot of research that's being done right now on creatine in the dementia and Alzheimer's world, and how it's helping with brain resiliency. It's helping with neuron regeneration. It's a higher dose than your standard. I'm trying to build muscle fiber. It's anywhere from 5 to 20 grams, depending on the research that you're looking at. So it's a high dose. So your standard muscle building is 3 to 5 grams. So you're starting to look at, all right, that's it's not going to taste great. But we start looking at, for neurogenesis, creatine is one of the big ones that will help. The rest of them are good with helping with the energy production, with helping control neuroinflammation.
Yeah, no, it's interesting. I mean, I don't want to continue down the rabbit hole too far.
That's a whole podcast in itself.
Yeah, creatine is one of those things that, like, over the years, it's just stuck around. And there's people that take it for muscle building, and there's people that take it for mental clarity. I mean, just anecdotally, and then there's also even evidence for that. I'm curious to see how the research continues there.
I was going to say everything in the supplement world becomes cyclical. Like 20 years ago, creatine was the most terrible thing everybody could ever have. It's going to kill everybody and shut your kidneys down and all these things. And now it's like,
if there's lead in it, then yeah,
right. Everybody's like, oh well, now we should all be taking creatine because it'll help with brain resiliency. And we'll buoy somewhere back in the middle, I'm sure, at some point down the road.
Yeah. All right. So for any athletic trainers that are working with concussion, I wanted to see, Matt, if you could just let us know, like, what are some subtle deficits that you could spot in a virtual visit that you might actually miss on the sideline?
For sure. One of the easiest ones is the amount of people that you're looking at, right? So, when we start looking at, as athletic trainers on the sidelines, you get maybe 1 or 2 concussion evaluations a day. If you're in a really busy environment, 1 to 2 a week or a month, I'm seeing 5 to 10 a day. So, when you start looking at subtleties, one of the easiest things that people miss is we have to know who the person is before they get hurt. Makes my job a lot harder because I don't know who they are before something's happened. But one of the perks of athletic training is you get the chance to build the relationships and learn who they are before they get hurt. So some things that often go overlooked is, as athletes, they're classically conditioned to keep going, right? I'm fine. Not that athletes want to lie to us, and not that athletes, want to always push through things when they're not supposed to. But if you've ever been to a basketball or a football practice and somebody falls down, everybody's yelling, get up, get up, get up, get up. Nobody's checking on them. Nobody's sitting here saying, okay, well, let's give them time. It's get up. So, one of the things that people will miss most often is the athlete coming over and saying, "I'm fine, I'm fine, I'm fine." It's a lot harder to prove that somebody is not fine when they're telling you that they're fine.
Right.
Um, so something that I get the benefit of in a virtual setting is, number one, time. My job is to give an athlete a hard time if they're not pulling themselves out from a game or a competition or a practice right after they get hurt. Right? Hey, that's not smart. It's really dangerous. You could potentially cause long-term difficulties. You could, die. So my job is to sit here and say, why didn't you come out? Realistically, that neurometabolic cascade, one of the main hormones that gets thrown off is adrenaline. They may not know something is wrong. They may not be able to tell you what's going on. We see it a lot in car accidents. I was fine for 2 days, and then afterwards, I've been dizzy and nauseous for the last 6 months.
Mm-hmm.
Yeah, it's because your adrenaline dump took 2 days. So
Well, the adrenaline, and then also, sorry, the adrenaline, but then also, I think we talked with University of Birmingham, where they're doing a study on that metabolic cascade that you talked about. And I'm not going to be phrasing this correctly, but somewhere around 48 hours, you start to run out of like stuff that you needed in the neuron.
Yeah, you start to run out of your glucose
and then
stores.
you're just not functioning properly anymore. So it's not just the adrenaline; it's the lack of available biomaterials, essentially.
Yeah. Right. When we look at that neurometabolic cascade, it's not I got hurt and then everything's cut off.
Right.
It's not, it's not
good for a while.
Yeah, all that energy doesn't just disappear, right? All the glucose stores that you have in the body, all the all the nutrients that the brain uses and enzymes that it uses, it's not like all of a sudden they're just gone. It takes some time to wear off.
Interesting. So, in terms of empowering patients to take control, so you get all this data. Maybe you don't know that much about the patients before they come in, but you meet with them and you do your testing and stuff like that. How do you take all that and turn it into something that the athletes can use to and as part of their recovery?
It's kind of the big philosophy that I have of the clinic is I treat people, not numbers. So one of the biggest areas that I see all the time is there's a lack of understanding of what's actually going on. When I go out and I present or I go out and teach or do these different podcasts, one of the things that I will talk about to everybody is I don't care how good of a treatment plan you come up with. I don't care what science-based, research-based exercises or protocol that you have that works. If the patient doesn't understand what's happening, they will not get better. So we spend a lot of time talking about the education side. When I sit down and I have an appointment, I tell everybody that's involved in the appointment, we are adults having a conversation. This is not me telling you how you're going to feel. This is not me telling you what's going to happen. This is me telling you that I am here to answer questions that happen, and I am going to take and explain the complex nature of the injury, and I'm going to explain it in a way somebody can understand it. So when we sit down and we take all of these tests, we need to make sure that, number one, the athlete, the family, whoever is around in the appointment, whether it's a spouse, a friend, a coach, a teammate, somebody who's in the evaluation with us, we need to make sure that we're all on the same page on what's happening. Now, do I have to have an athlete that understands that, okay, when the injury happens, the neurometabolic cascade takes anywhere from 0 to 6 hours for the adrenaline rush, for 30 days for the neurometabolic cascade to occur and kind of regenerate? No, they don't need to know that. But they need to know, okay, all right, headaches in the front part of my forehead. It's usually a combination of visual disruption, fatigue, dehydration. Headaches that are all over the head are generally a combination of overstimulation, too much noise, too much movement. The back of the head and neck are generally cervicogenic and whiplash type symptoms. So getting them a chance to have them understand what symptom fluctuations happening, get them to expect that symptoms aren't the bad guy during concussion recovery. Symptoms are telling us what we need. So when they're going up and down, getting them to understand what the symptoms mean, not just, well, I was at school and I felt like I was going to throw up, so I went home and then just stayed in my room all day. We have to teach them, activity modifications and different ways to keep them in as much of their normal routine as they can without overloading their system.
Yeah, I bet you that comes back to what you said about treating the person, right? So one person, like if it was me, I don't know, maybe not when I was 13, but I would definitely want to know all that information about the neurometabolic cascades and stuff. But some other people maybe, don't want to know that. So you got to tailor it for the person that you're treating.
For sure. Concussion information can feel like you're drinking water from a fire hose.
Yeah.
right? So when I sit down, I look at it, I was like, all right, I have a funnel on what most people want to know on day one that I will start to funnel down into. Okay, what's the important takeaways? What's the expectations on what recovery kind of will look like, and the loose trajectories on what recovery should look like? And then we can go into, okay, I've got somebody who's, talking a lot when they give me their initial stories that they're dealing with mental fogginess, or I've got somebody who, like, I was doing fine and then I went to church and the room won't stop spinning. So then we can get into, okay, now that we've talked about it specifics, here we go.
Awesome. So during one of your evaluation sessions, or I guess just any of your treatment sessions, how can you tell the difference between cognitive fatigue, visual strain, and just regular anxiety? And how does that change what you're doing during that treatment session or evaluation?
So the easy answer is not very easily, right?
Okay.
And that's everything with the brain injury, no matter what, right? I will tell you experience, right? The fact that I've been doing this for a decade now, the fact that I've treated over 1,400 patients, like, you're starting to learn more of the treatment aspects of things, and you're starting to see them. The easiest one that we can kind of tease out of that group of three is the visual fatigue or the visual strain. Generally changes to visual clarity. Every time I do an exercise or every time I do an evaluation, as soon as we finish, I will ask if there's any changes to what happened, any dizziness, any nausea, any changes to visual clarity. There are a couple of symptoms that I want a patient to be very honest with me right away. And it's usually any changes to visual clarity, whether things go blurry or they get crystal clear, and then dizziness, because dizziness is the one that scares people. So when we're doing an evaluation, after every single one, I want to know if there's any changes, because that tells me and that helps me grade my duration of treatments, or we can make changes to treatment plans based on how each one responds, depending on the variables that we put into the exercise itself. Anxiety is one that's going to be around for every single person, right? If you break an arm, you know generally what to do, right? We get the cast and we leave it alone, right? If you break a leg or you tear an ACL, like, there's been enough coverage in media and movies and TV shows that you generally have an idea on what is going to happen.
Yeah.
Brain injuries, you go to the emergency room, you get a CT scan, the CT scan comes back negative. They tell you that, well, you'll be better in a couple of days. In 6 weeks, you're still struggling. Well, they told me I'd be better by now. So now what's wrong with me? With my clinic, I am not the first step. I'll be perfectly honest with you. If I can get somebody in the first 30 days, like, I'm doing an internal happy dance where I'm like, all right,
Oh,
here we
okay.
go. We got it going. We get it going. Generally, I'm the ones that we've tried everything else and don't know what else to do. I'm the parent, the parent of the athlete that's up at 3 o'clock in the morning because their daughter hasn't been to school in 3 days, Googling, why is my daughter still having a headache after a concussion? Generally, it's not the easy ones that I get. Like, I love the 48-hour turn and burns. Those are great. A lot of times with those type of athletes where they get hurt in a basketball game on Friday and I eval on Monday and they're back to normal within 10 days or 14 days or so, like, those are great because you get the feel good stories. It's like, all right, we went really consistent, we were really fast. Realistically, I am the one that, hey, I've been symptomatic for 6 months. The medical system has said, well, there's nothing else that we can do for you. What can you do? And that's the ones
Okay.
that need the most help, because the medical system doesn't understand what they can't see.
It's interesting you mentioned about the difference between physical injuries and concussions. We have a league that we've been working with for a long time, and they had data for, I guess they do some sort of a evaluation or self-evaluation the athletes do on their, and part of it is on anxiety levels. And when there was like an ACL sprain or something like that, anxiety levels would be pretty high. When there was a concussion, anxiety levels were really high.
Yeah.
And then we've been working with them for a long time now, and we've seen the trend reverse, where now athletes are less anxious on average when they have a concussion than when they have an ACL sprain, for example, because now that the protocol is developed and they know, they've seen other athletes go through the protocol and come back, like you said, like after 7 or 14 days or whatever is appropriate for them, they kind of feel like they have a structure that they can follow and that it gets treated like a regular injury.
Yeah, it's interesting. A lot of it boils down to timelines, right? If we knew, like, let's say a concussion protocol shifted to, well, that neurometabolic cascade takes about 30 days, the athlete shouldn't go back before 30 days. Like, if we shifted the protocol that way, the anxiety would be significantly higher. When I look at the anxiety after concussion versus like an ACL tear, The first thing that I think of is, well, they know that for the next 9 to 12 months, they're out.
Yeah,
And you
the
start looking at,
timeline is a bit longer. Yeah.
It's right. If I tear an Achilles, like my first thought process is not, oh, okay, can I play next week? It's, do I ever get to play again? Or will I be back before the end of the next school year? It's not a, generally speaking, with athletes and concussions are a bad word in the athletic population.
Yeah.
The stigma around them is getting better, but you still have half of the athletic world. I'll even venture to say half of the public, the general public, that, oh, back in my day, we had, I played with concussions and I don't remember 3/4 of my football games in high school. It's like, great. You're also part of the generation that's being diagnosed with Parkinson's in their 50s and not their 70s. You're in the high dimension Alzheimer's generation that's not good either. So
Yep.
it's an interesting stigma when it comes to it. And it's actually interesting that anxiety is lower with concussions because of the disruption of the hormones that causes anxiety.
Yeah. So for the last couple of questions here, just as we wrap up, I want to shift gears towards how you collaborate with boots on the ground, or if you collaborate with boots on the ground. So
100%. 100%.
Yeah. How does that work with like the patient's local team, their athletic trainer, their doctor, return to play or return to learn protocols?
Yeah. So the first thing that needs to happen, or in my opinion, needs to improve across the board, not just with what we do, is the communication aspect, right? It takes a village. I can't do everything. I wouldn't want to do everything, right? So when I sit here and I have an athlete, especially locally, I have an athlete, I know who their high school athletic trainer is or their college athletic trainer is. I know who their family physician is. I will make sure that, number one, I call everybody. So I want to call their physician and talk to them about what I've seen. I want to call their athletic trainer and talk to them about what I have going on. I will put together 2 different type of rehab protocols. One that the athlete can handle, that are basic things that they can do at home. Basic eye tracking, basic movement, low technology, low demand. But if they can do that consistently on a regular basis, we can take those small steps to recovery. I will also talk to their athletic trainer and say, okay, look, here are 4 exercises that you can do that I will curtail based on the athletic trainer's availability, because we all know in that space, time is the biggest limiting factor they have. It's not like with a lateral ankle sprain that you can give them 4-way ankles and send them in a corner and be like, all right, good luck. You can't do that with a concussion patient. You can't send them to the gym and be like, all right, here are these 6 exercises for you to do, because if they're throwing up in the corner, you don't know what part of that caused the problems. So, you curtail it towards the specific athletic trainer's availability, the specific athletic trainer's understanding. And then I am also very vocal with the athletic trainer that if you do not have the time to devote to this, I usually see my high school and college age athletes 1 to 2 times a week. I will sit here and we'll supplement, we'll build a little bit more of an advanced home exercise program. If I have a college athlete, I will sit here and try to get the strength and conditioning coach involved, try to get a position coach or a assistant coach that can be my boots on the ground to help the athletic trainer, especially at those smaller colleges, to kind of keep everybody on the same page. I'll work with team physicians to make sure that they understand kind of where I'm at. Return to learn protocols. I have a concussion professional development that I go out and teach to local high schools and colleges to try to get protocols that are put in place to make sure that policies are formal, like the NCAA has for athletes. I help universities do that for non-athletes. It's a wide world that we have the education side that proves that, hey, education and academic accommodations can really help.
Right. So on that note, then, based on your experience, how do you create that environment where in the athletic setting that they're like concussion ready, so that when the injury happens, they've got a reporting mechanism and they have a plan?
It depends on what level you want to talk to, right? If you're trying to talk to an admin, the easiest way to get them to comply with trying to set up that atmosphere, litigation. You want to know what the number one litigated sports-related injury there is?
Yeah.
So it's a hotbed topic. It's a media-driven topic. So at the very top levels, you start looking at, okay, do you have a protocol in place? Because if you don't, not only do you open yourself up from trouble with like the Indiana High School Athletic Association or the NCAA, you also open up to liability and litigation. So one of the easiest things, and kind of like one of my key catchphrases that I talk about, is I am very self-aware when it comes to my business. Nobody cares about concussions until something happens. Whether somebody gets hurt, recovery doesn't go well, litigation occurs, you lose a game because something happened with a key player. Nobody wakes up in the morning and goes, you know what? I want to make sure my athletic department's concussion protocols are in check. Nobody wakes up in the morning and says, you know what? I need to make sure that I've took my vitamins this morning and tried to do everything I could to present, to build brain resiliency, because I'm going to fall down the stairs to this evening, and I want to make sure that my brain is ready for the injury that's going to occur. Nobody cares until something happens. So when I go out and try to talk to different schools and different hospital systems, one of my first things is, do you have a formal protocol in place? And if you don't, I have the resources to help you.
Awesome. So last question here, just looking ahead, is there anything that you're excited about in the concussion space, new tools or philosophies that you think will really change or move the needle, not just marginally, but will really advance the space?
Yeah. So in the big picture, it's the continued research, right? We still have so many laps and limitations in our research protocols because of kind of the way we have to research brain injuries. Nothing is fast. Nothing is fast in the brain injury world. So getting research done is really hard. A majority of the research that's being done doesn't include females or has very limited female application to it. So the more there's been a big protocol here in Indiana, there's been a big push for female athlete research. Indiana University has been one of the groups that has kind of partnered to increase research on female athletes in general. So the continued research into the female recovery, continued to look at the vitamin supplementation side of things, making sure that we're supporting the brain not only physically, mentally, and emotionally, but supplement-wise and vitamin and nutrient-wise. The implementation of AI is going to be one of those really interesting things. I think, the more we can put into accurately diagnosing concussions early on, the better things are going to go. I tell everybody my big goal with the concussion clinic is someday I want to wake up and there's a pill that you can take or a supplement that you can take or a treatment that you can do that they can give to you right there on the field, and everything heals right away. And I have to close the door saying, you know what? I'm not needed anymore. That's my whole goal in the concussion space. Is we get to a point. Yeah, man, it would be nice. Like my whole goal and philosophy in life is to help people. Right now, the concussion clinic is my boat to help people. Eventually, if my whole goal is that the boat doesn't need to sail anymore, and I can put the boat away and find a different boat to work with.
Awesome. Well, really appreciate your time, Matt, and thanks for jumping on today. Is there anything else that you wanted to mention before we hop off today that you didn't feel like you got a chance to get across?
No, I appreciate you having me on. One of my key takeaways that when I talk about concussions in the very end is I kind of want everybody to understand that concussions are called invisible injuries for a reason. Not only is it that we can't see it on scans, we don't see it on advanced imaging, it's also the fact that we don't know what anybody else is going through. I have no idea what my patients feel. I know physiologically what can happen. I know what symptoms they might expect. I know how I felt when I had mine, but I don't know how they feel. So the whole concept of trying to create environments where people understand that everybody's going to respond differently, everybody's going to heal differently. And when we look at the big picture, not only do we not see them on scans, not only does everybody react differently, they're really isolating. So when we sit here and we look at kind of an athlete who maybe their recovery hasn't gone as easily or as smoothly as everybody wants, you don't have to tell them that, hey, we need you back on the field. They know. You don't have to tell them that, hey, man, this sucks that you're out. They know, right? So being supportive, being understanding, being nice to them, making sure like, hey, look, I didn't text you today to say, hey, you're letting the team down because you're not playing next week. I generally wanted to check in to see how you're doing. Hey, man, everything good? Do you need anything? Can I help you with anything? Being nice to people, understanding that not everything happens the same for everybody. That's my key takeaway. You never know what somebody else is going through, so be nice.
Wise words. Well, we really appreciate you coming on the podcast, Matt, and thanks for everyone for watching, and hope you all have a great day.